Welcome back. Diabetes affects a large percentage of the nation's population, and joining us now through our sponsors at UBMD to talk more about prevention and treatment options is Dr. Robert Masek. Thanks so much for coming in today, doctor.
Thank you for having me.
Of course. I'd love it if you could start by explaining to our viewers what diabetes is.
Sure. Diabetes is a chronic condition that the body is unable to process large amounts of sugar. Most often due to a lack of insulin or the ineffective use of insulin, resulting in high blood sugar.
How common is diabetes?
Diabetes is quite common. About 11% of the United States population is affected, with about 90 to 95% being diabetes type 2.
Well, I'm glad you mentioned that because there are different types of diabetes and also different causes. Can you explain them?
Sure. There's a few subsets of diabetes. The primary ones would be type 1, type 2, and gestational diabetes. Type 1 diabetes is an autoimmune disorder where the body has some degree of antibodies that attacks the pancreas, leading to a lack of insulin. Diabetes type 2 is an inefficient use of insulin or not enough insulin. And gestational diabetes is very similar to diabetes type 2. However, most often it will resolve with the delivery of the baby.
Okay. Let's talk about some of the symptoms for people to be aware of and maybe signs that they should go to their doctor and get tested.
Absolutely. We look at the symptoms as a diabetic triad. So increased thirst, increased hunger, and frequent urination, or the telltale 3. There are other presenting symptoms such as fatigue, unexplained weight loss, blurry vision, delayed wound healing, and then burning and tingling of the feet.
Let's talk about the treatment options for diabetes.
Sure. Treatment options for type 1 diabetes, since there is no insulin available from the pancreas, would be all of them will require good diet, exercise, and then insulin injections for type 1. For type 2 diabetes, again, diet and exercise. There are oral medication options as well as injectable options such as insulin, or Ozempic, and Mounjaro.
Okay. How do doctors actually diagnose diabetes? What does the testing look like?
Sure. Diagnosing diabetes starts with physical examination, a thorough history, and will often lead to screening blood work as well as some urine screening.
I know that, the technology has come a long way with diabetes, and people that are diagnosed with it are able to live a relatively normal, quote-unquote, life, right?
Sure. Yeah, absolutely. I'm actually diabetic myself. I diagnosed a couple years back, and I live a regular, everyday, normal lifestyle with good treatment options and management, and good, healthy diet and exercise is very important.
And speaking of management, how often should patients with diabetes be seen at a doctor's office?
Sure. The tried and true most important is the annual physical. At the annual physical, we'll kind of update the history, do a physical examination, dilated eye exam, comprehensive foot exam, and then screen how our blood sugar and urine are doing.
Okay. What are some of the complications that diabetics face?
Sure. Some of the more severe complications would be when the sugar is too high or too low, which can often result in hospital care. Other complications involve many of the organ systems. So it can be the heart, the kidneys, the gastrointestinal tract. We can have troubles with skin, blurred vision, and often joint-related issues as well.
I believe that type 1 diabetes, that is something that people tend to just be born with, correct?
Not so much born with. Because it's autoimmune, it's often followed by an illness.
Okay.
So normally in your childhood, you can get a viral illness. The body will generate particular antibodies, and those antibodies will actually attack the pancreas.
Are there any things that people can be doing to try to prevent diabetes?
Absolutely. Diabetic prevention is tried and true, what we do every day in primary care. If you screen early, attend your annuals, and get your blood work, we can potentially catch diabetes in the pre-diabetic state. And pre-diabetes would kind of be an A1C from 5.7 to 6.4, and that is reversible through diet, exercise, potentially oral medication. But once you become a diabetic, it's a lifetime chronic illness. So you're either controlled or uncontrolled based off your blood work.
Are there any specific food groups that are known to have adverse effects when it comes to diabetes?
Sure, there certainly is. A lot of doctors will tell you diet and exercise. I mean, exercise is great, 5 days a week, 30 minutes a day. As far as dietary counseling, there are diabetic educators, nutritionists, but the normal route is limiting your sweets, your simple sugars. If you put a lot of sugar in the coffee, drink sweet beverages, candy, all of those should be decreased. Carbohydrates, the biggest offenders would be pasta, bread, and potatoes, everybody's favorite, as well as some of the fatty foods, which is anything fried, dairy products, ice cream, any of these. And you should enjoy the products you consume.
It's all in moderation.
However, moderation. Yeah, in America, our biggest problem is portion control. And if you can dial these back, replace them with good fiber products. As fiber passes through the body, it takes sugar and cholesterol with it.
Alrighty, Dr. Masak, you've given us great tips. Thank you so much for coming in. Viewers, if you'd like to learn more about how our sponsors can help you manage your diabetes or get screened, you can visit their website, UBMDPrimaryCare.com. Thanks again for coming in.
Yeah, thank you for having me.